Welcome, everyone. My name is Glenn Hill. I'm the Executive Director of Minnesota Food Association. We're a nonprofit organization. Primarily, we train new immigrant farmers. But today, I'm here as a representative of the Neighborhood Food Project. And I'm going to give a brief introduction. We have about 6 minutes. And then I'm going to turn it over to Valerie. But one thing came to mind, and when I looked at the recommendations, one that I think of is family and setting aside time to eat as a family, whether it's once a week or twice a week or more than that. I think that has an influence on the future. We wanted to approach this project from a grassroots approach and to hear what the people thought more than what we thought. Reminds me, I'll make it quick. I lived in Thailand for many years, and I was living with a Thai family who had a 9-year-old daughter, and one time on a trip back to the States, this was 1989 or so, at that time there was no diet soda in Thailand. We came here. It's great to see the United States from the perspective of a 9-year-old Thai person. My cousin bought her a Diet Coke, and she tasted it, and she looked at me and she said, "This doesn't taste like Coke in Thailand." I said, "No, it's diet. See on the side it says D-I-E-T. She said, "Oh, doesn't taste very good." I said, "No." She goes, "What's diet?" I said, "Well, it has less calories. It doesn't make you fat." And she said, "Why don't you drink regular Coke and just exercise?" And I said, "Let me ask my cousin." But that's the perspective. We want to hear not from our perspective. So there were a group of us that were wanting to address the issues of food accessibility, inequality in food accessibility, food affordability in neighborhoods in the Twin Cities. And we got together in 2008, and we're putting a proposal to the USDA Community Food Project program. We put together a proposal. It was not approved, and it was kind of tabled. And again, in 2009, we got together and we wanted to do this again. And we had a number of organizations come together and talk about this. And finally, through these discussions, we came down to 4 organizations that were really committed to taking a stab at this. It was the Minnesota Project, Afro-Eco, the Community Design Center of Minnesota, and Minnesota Food Association. In our initial discussions, I think it's important to see how these partnerships came together. In our initial discussions, our goal was to address food insecurity and come up with ways that would address food insecurity. And we were looking at St. Paul. But in these initial discussions, we had this realization of what is the food insecurity here? What are we even talking about? We're sitting in a room around a table coming up with these ideas. And so we took a step backwards and we said that we want to do a planning grant instead. They have 2 types, an implementation or a planning. And we said, let's do a planning grant. Let's take a step back. Let's take a real grassroots approach and try to find out what do the people think? What do they consider healthy eating? What do they consider food insecurity? What is the situation in their communities? So that is how we came together. The goals of the project were to find out what does food security mean? What does food insecurity mean? Where do you get your food? What are the issues facing you? What are the barriers? What are the positive effects that you feel about your food? You can see up here, but are people interested in this, or are we just barking up the wrong tree? And in the end, what would really help you in your situation to eat more healthy food? We went about this in a variety of methods. We conducted a survey. We developed a survey, which was a long, arduous task, but it came out really good. In this process, I want to mention also that we were working with the SHIP program of Ramsey County Health Department, and through the SHIP program and through Ramsey County, we also partnered with the Wilder Foundation. And so bringing these 2 components together our initial group was very powerful. We each had many good things to bring to the table. We conducted a survey. We surveyed over 500 people, of which 478 of these surveys were usable. We put together an advisory group of probably 25 to 30 people to help us discuss the survey, to help us discuss the process as it was ongoing. We held 12 focus group discussions in the Payne-Phalen neighborhood and the Summit U neighborhood, and gathering people, and we'd provide a dinner, and we'd have discussions and get the verbal qualitative feedback. And then in the end, when we had a draft report, after we had gotten all the results back and we had draft findings, we had 2 community dinners, one on the east side and one here in the Summit University area, and presented the results to the community. And that is where we stand right now. We have put together a final report that still needs to be finalized, and we would like to disseminate this report. But the real challenge facing us now, which will segue into Valerie's talk, is now that we have this data, nothing really jumps out at you as this is the path to go. How are we going to move forward on this? And our initial idea is that it's going to require many collaborative partnerships of different sizes and scale and a multi-pronged approach. With having said that, I skipped over this, but this is basic demographics of who were the respondents to the survey. And you can see that we reached a variety of, or it was primarily more limited income households. And this is initial findings of where people got their food. This is only from the survey data, not from the focus group data.
One of the things that Glenn just said was that there weren't a lot of things that jumped out at us, but there were some, I think, some significant results that we got from this particular study, this survey and focus group study that we did. But I should say that when we started to do the survey and the focus group, that we did have some very specific overriding or guiding questions to help us tease out and to reach the goals that he had identified on the slide before, but really to help us tease out 4 things. We wanted to tease out the assets that were available in these communities, you know, something that many of us talk about, I'm sure many of you as educators talk about, but we wanted to find what kind of assets were available in these communities with respect to their food knowledge and their food capabilities. We also wanted to find out about the barriers, and that was really probably the primary focus is barriers, because that is, you know, if we're trying to solve a problem, we're looking at what are the sources of the problem. So certainly the barriers was important. But we also wanted to find out from the people themselves, as has been said by the Wilder folks before, from the people themselves, what their needs are, what their perceptions were of their needs. And so those are kind of like the overriding questions or framework that we use in order to develop our questions for the survey. You know, we had lots of issues in terms of those questions, because you can never ask all the questions that you want to ask. And so to some extent, our results are limited because we had to limit, you know, our questions in the survey. But that aside, for me personally, and having talk to other members of the group, one of the things that does jump out at us, and it may not seem to you to be very significant, but we thought was significant, was this slide here. How interested are people in eating more healthy foods? Now, for us, this was very significant. You'll see that 55% of people said that they are very interested. And why do you think that was important to us? I think it's for 3 reasons, and I think it's not only important to us, but for those of you out here in the audience who are, you know, working in this area and are educators. We think that this was important because it says, number 1, that you've already done a good job. Okay, it says that that we've done a good job in terms of raising consciousness. Some of your education efforts have been, are kind of bearing fruit in these low income, these four low income neighborhoods that we surveyed, meaning that people are saying, yeah, I want to eat healthily. This is important to me. So, in many instances, as Paul was saying earlier, the behavioral factors are unfortunately sometimes the factors that we focus on, and that many people want to focus on is what people are doing. Now, just because folks are saying that they're interested doesn't mean that they are doing things. But I think this is a first hurdle, a big hurdle, and a very significant outcome is to show that people are there with us, and it's not a matter of trying to educate to convince people that they need to be healthy. So it's not just a personal thing that we have to be about. We certainly have to be about the structural things that Paul talked about before, and that Melanie also talked about, that this is certainly a social structural issue here, and not just a personal one. But the other reason why we think this is important is because we think that it appears to be an emerging strength or an emerging asset. When we're looking at assets, this is an asset, for all intents and purposes, meaning that you can work with this. This is something that you can do, piggyback on this or work with it. And then and thirdly, it does reinforce the fact that we need to be focusing on those systems and policies and structural things. To what degree do the following issues affect your ability to eat healthy food? I think what's really most important here that we wanted to point out for you is that price. Price is everything. Price is everything. When you add the somewhat and very much degree to which people are concerned, or issues that affect their ability to access healthy food, it is price. All those other things that we normally think about in terms of transportation and other things, they're here, but price is number one. 79% of our sample said that if food was more affordable. Now, affordability, what does that mean? I think we need to tease that out a little bit more, but price is certainly up there. These are listed in order, if you will, if you would add these and go down, these are listed in order of significance and importance to people. So quality of food in the stores where I shop, that hasn't come up too much here, but certainly quality of the foods where I shop. That was 66% of the people said that somewhat or very much. Availability. What does availability mean? Does it mean that there are various measures of availability? Whether people can walk to the stores that are within so many miles, or whether they have transportation to those stores. But availability did come up as 61%. Time to shop. That, how often do you hear this? Time to shop and time to prepare. Probably most of you, because you're busy, know about this, but certainly in low-income families, we have certainly the same issues. 60% of the people said time to shop. 62% of the people said time to prepare. That those are barriers to them actually eating healthy food. So again, as you're looking at what you have to do and need to do and coming up with strategies, you have to think about these real concrete things here, okay? So these are some important features. The one thing, though, when we ask the question, what was the one thing that would help you to eat more healthy? Again, 43% said when you look at the one thing, the other side was looking at array of things, so they could list an array of things. But when we ask this one, price again comes up as the primary thing, and then you see the others in descending order. How interested are you in learning more about the following? Again, I think this is important for us here and for you as educators. What did the people say that they wanted to do? And growing our own food, it comes up high here. 61% said that they were either very interested or interested. Obviously, there's issues with that. We didn't talk about what some of those issues would be, but certainly some of those issues that are barriers to people growing their own food is having the space to do that. When people are low income, they don't necessarily have backyards, okay? But there was some discussion in Melanie's talk about community gardens and that kind of thing. So people have expressed, that was one of the highest percentages here, of wanting to grow their own food and feeling that that would be an avenue for them to have healthy food. Canning, cooking, learning how to choose more healthy foods, and buying from farmers. Those are, again, in pretty much somewhat descending order. Actually, the highest one here was cooking and buying directly from farmers and then growing your own food, and then the last one was canning. So these are some important personal things that would help people actually implement and be able to deal with satisfying their interest to eat healthily. And I think that these serve us well, these data serve us well in terms of thinking about what we can do for people in low-income communities.